morning and welcome to Oncology Data Advisor. We're having today's episode in honor of Men's Health Week, which is observed this year from June 9th to 15th. And I'm joined by today's guest from our editorial board, Dr. Stephen Freedland, who is here to discuss the topic of prostate cancer prevention. Dr. Freedland, always great to have you on the show.
Kira, it's great to be here. Thanks so much.
Of course. To start off, I'd like to introduce yourself and share what your research in prostate cancer focuses on.
Yeah, so I'm a urologist at Cedars-Sinai Medical Center in Los Angeles, California, and I focus on kind of the broad spectrum of prostate cancer, from early stage disease, even prevention, early diagnosis, to late stage disease, with a strong focus on both health disparities and the role of diet and lifestyle.
Amazing. So before we kind of delve into this topic, I'd like to start off by giving us some background information about prostate cancer, what causes it, how common it is, how lethal it can be.
Yeah, no, absolutely. So the prostate is a small walnut-sized gland that sits under the bladder in people who are assigned male at birth. So not everyone has prostates. About half the population has prostates. Um, and they can do many different things as we get older and cause lots of problems. They can enlarge and cause problems, urination, but they can also turn into cancer, unfortunately. And it actually is the most common cancer among men and the second most lethal cancer. And I recently heard a statistic which I have not yet been able to verify, but actually is among non-smoking men, it actually is the most lethal cancer. Um, so it's certainly common. Fortunately, it tends to be slow growing, such that we have some time, we have effective treatments, but there is still a large number of men dying of this disease, and we need to come up with better ways to prevent it and treat it. And that's what we're focused on in our research.
Absolutely. So, on this theme, an important topic this Men's Health Week is prevention and what men can do to reduce their risk. Are there any drugs or supplements or lifestyle factors that can help to do this?
Yeah, and I mean, answers perhaps, but with prostate cancer, when we talk about preventing getting it, we often are thinking about ways to prevent dying from prostate cancer because it is so common. So many people do get it, and we're not, many of those people we don't even have to treat. So there are drugs that have been studied, finasteride and dutasteride, that reduce the risk of being diagnosed with prostate cancer, but they really didn't reduce the risk of the aggressive cancers. If anything, they may have actually increased it slightly. No data that they reduce the risk of dying of cancer, or no consistent data, I should say. And so, really not approved by the FDA for that use. We really don't use them for prevention of prostate cancer. And so, really, a lot of our focus is early detection, try to find it early so that we can treat the bad cancers, and just maintaining a healthy lifestyle. We do know that obesity is linked with lethal prostate cancer. Again, probably not as much just getting prostate cancer, but certainly lethal disease. So really try to focus on healthy living, avoiding obesity, making sure you're getting your exercise, those kind of focus areas.
Great to know. Since, as you mentioned, a lot of the prevention centers around how you can prevent lethal disease if you do get prostate cancer. If someone is diagnosed, what are the best ways that their outcomes can be optimized?
Yeah, so I mean, the best way is to find it early. Gives you more options as to what to do. And just because you find it early doesn't mean everyone needs to rush in and have surgery or chemo or hormones or whatnot. It just puts more options on the table. And so the best way to do that is to get a PSA test done. Guidelines have varied and changed over time. A lot of them now, certainly it's shared decision making discussions with your doctors. What I personally recommend is a baseline PSA somewhere in your early 40s. And if that's normal, you could probably wait a few years, maybe even 5 years to repeat it. But starting around age 50, 55, to move to more regular PSA testing, which would be every 1 to 2 years. And then at what point, if those remain normal throughout your life, do we stop it? Highly controversial for me. It's one I don't think the patient's going to live at least 10 years, which on average for the average person is closer to 75. But there's 80-year-olds who are plenty healthy and still, running marathons. So it's highly individual in terms of how we screen. But once diagnosed, there are treatment options we have. So again, if it's not so bad and we found it early, it's not aggressive, we can sometimes just watch the tumor, do nothing. And it's called active surveillance. And it's, really trying to select out those that are really unlikely to die from the disease and really try to reduce the side effects of the treatments. If it's a little bit more aggressive, sometimes we'll do focal therapy, just kind of zap that little area of the tumor. And there's a few different technologies we can use to do that. But if it's more aggressive than that, typically would be surgery to remove the whole prostate, or irradiate the whole prostate. And obviously, if it's spread beyond the prostate, that's when we start to bring in the hormonal therapies, perhaps chemotherapies, other things. But hopefully, we can find the cancers early enough, intervene, and prevent all those downstream treatments that, while effective, they certainly come with side effects.
Absolutely. Great to know. So as I wrap up today, in honor of Men's Health Week, what messages would you like to share, first of all, with men listening in about what they can do to reduce their prostate cancer risk? Any take-home messages there? And then messages for clinicians on this topic.
Yeah, in terms of the patients listening, be proactive. Men tend to, not be the most proactive with their own health. They're usually pushed by a partner or a spouse. But you need to be proactive and take care of yourself. Get PSA tested. I think there was a fear of rectal exams. That there is, and that doesn't need to be a part of your prostate cancer screening. Some people think it adds some value. Controversial, but even if you just get the blood test, you're getting almost all the benefits. Don't be afraid of it. Information is power. Get that test, and then whatever it shows, deal with it from there. But the other things you can do outside of that, once a year, once every 2 years, getting that blood test, is make sure you're eating right, exercising, avoiding smoking, because there's data actually linking smoking with aggressive prostate cancer, limit alcohol, and enjoy life. In terms of the clinicians, again, I would say, I think PSA has gotten a bad rap, because we didn't necessarily know how to use it well. I think we're using it a lot smarter, and the data in terms of the benefits are increasingly clear that PSA testing really can benefit our patients.
Great to know. Awesome. Well, thanks so much, Dr. Freeland, for coming on today to share these messages with us and helping us to raise some awareness this Men's Health Week.
Thanks so much for having me.